Welcome to the Birth Lounge podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Welcome to the show.
Thank you so much for inviting me. So excited to be here.
Yeah, absolutely. I'm so excited to have you because we've never talked about preterm birth on the show before, and it's obviously a really, really important topic. It's something that can be very dangerous, and I think we're still figuring it out as humans and a medical system. So stoked for this conversation. I think before we dive into too much of the weeds and the education, a good place to start, because I'm actually not sure how many people know that much about preterm birth, is what does preterm birth in America look like? What are those numbers and those stats? Where are we starting when we dive into this conversation?
Great starting point. First of all, preterm birth is defined birth before 37 weeks of gestation, 3 weeks or earlier than the normal 40-week due date that the physician gives all of the expectant mothers. And unfortunately, in this country, preterm birth is on the rise. It's been quite stable. At about 1 out of 10 women will deliver preterm. And it's really important to learn about it and talk about it because so much of it is unpredictable. About half of those who will have a preterm birth delivery have no warning signs. It's called spontaneous preterm birth. Overall, 1 out of 3 women will have pregnancy complications. So starting to think about in your pregnancy about what risks could come your way is super important. So that because a lot of them, even though they're not always predictable, they are preventable. And now we have more tools than we had a decade ago to start predicting and screening for those potential complications and specifically for preterm birth.
Wow. Okay, so talk to us about that. What did testing for preterm birth used to look like, and what kind of tools do we have now available to us?
Yeah, so physicians always look for short cervix, but fewer than 2% of expectant mothers have a short cervix. So very few of us will face that. And of course, history of preterm birth will become a risk factor for subsequent preterm birth. That said, for first-time moms, nearly half of all moms are first-time moms. So that risk factor is not available to screen for potential preterm birth. I lead Sera Prognostics. It's a publicly traded company. We've been in the market for over a decade, and we've studied preterm birth and deployed the proteomics testing to understand risks for preterm birth. So we've launched a test called Preterm that allows us to predict risk of preterm birth as early as 18 weeks of pregnancy, in the first 18 weeks of pregnancy.
How does that work? Is it a blood test? Is it a urine test? When do we get the results back? What do the results tell us? Is it a confirmation? Is it a diagnosis? How does that work?
As I mentioned, preterm test allows us to screen a pregnancy for potential to deliver before 37 weeks of gestation. It is a blood test. It's a test you can order online, And you can do a finger prick either at home or you can get the test through your physician. You do the test in the between weeks 18 and 21 of pregnancy. And the test gets shipped. Either the expectant mom can send it by mail to our lab in Salt Lake City, Utah, and we deliver results within 3 to 5 days, or of course, through the physician, and we'll get the results out to you as quickly as possible. What the test screens for and the results show is whether an expectant mom is at higher risk for preterm birth. So that outcome of unfortunate delivering the baby before 37 weeks of gestation. And when we talk to OBGYNs, we've learned that every single day of gestation counts because the baby gets more formed, healthier, gets born healthier. There are a lot fewer complications if baby is born and is full-term baby.
Okay, so essentially it's a blood test that's going to screen for markers that tells us, hey, this person is at a higher risk than your average human and they may go into preterm labor. Is that right?
That you got it. That's
Okay,
exactly.
so with that information, what will we do? How will that change the care? What kind of actions can be taken with this data if someone does get the results that they screen for these markers and they're at a potential risk?
Yeah, so if you test at high risk for preterm birth, luckily we've tested a simple intervention bundle that you and your physician can deploy to make sure that you reduce the risk of preterm birth and extend the gestation as long as possible for the baby to be born later, healthier, and you stay in the hospital and the baby stays in the hospital as little as possible. So what are those interventions? There are three main components. One is so-called baby aspirin, so very low dose of aspirin daily, 81 milligrams. Second one is vaginal progesterone administered daily. And the third one is a very important one, is a weekly structured OBGYN nurse call to make sure that your pregnancy gets monitored throughout the remaining term of your pregnancy. In these conversations, you learn more about what to watch out for in potential risk for a preterm birth or complications. And it empowers every expectant mother with a lot more knowledge that an average risk or low risk mom would get in her pregnancy care. We've heard from the physicians that we work with and the expectant moms who got the test, how much a peace of mind they had through these weekly conversations when they got the test, even if they got a higher risk reading on their test report, that allowed them to deploy these interventions with the physician, get monitored more intensively, and deliver to full term because they've done that in the pregnancy.
That's incredible. Okay, and how many people that tested high risk for this go on to actually deliver preterm?
That's a great question. I can follow up with the statistics on, but we pride ourselves with this intervention to be able to support most mothers to go ahead and deliver to term with this set of interventions.
Yeah, because
And
they're doing that bundle.
exactly right. Exactly right. And each of these interventions is very safe and well precedented used in the marketplace today. I think everybody has taken aspirin before. It's been well studied to support complications in pregnancy and avoiding complications in pregnancy. Vaginal progesterone, also very safe intervention. And talking to a nurse would just ensure that a mom is as armed with information in order to manage her pregnancy as she possibly can be.
And do you do all three of them together? That's why it's a bundle. Ideally, we're doing them, it's a trio.
It's a trio. Absolutely. And we can't decouple. Sometimes physicians and mom tell us, what if I do conversations with the nurse, but I don't take the aspirin? I would strongly advocate to do them together because in clinical trials, and I'm happy to dive deeper into what we've learned in treating thousands of expectant moms, we've learned that it's really the combination of the three that makes a huge difference in extending gestation for babies. Babies stay in utero longer. They are born healthier, measured by composite index in our clinical trials, and they get out of the hospital sooner. Consequently, moms also have better outcomes because, of course, if the baby is healthier, if the mom doesn't have her own health complications, it's just a much easier process, and there will be fewer other complications that sometimes occur post the birth of the baby, and a lot easier care for the baby in the first year of their life.
Did you see a reduction in NICU stays?
We did. We did. So let me dive into the studies that we'll make available, and I would love for every expectant mom to just take a peek at. One study that was on the cover of the Diagnostics magazine in July of this year, where we published our study results of a study called AVERT, where we screened moms and had the physicians give them aspirin, vaginal progesterone, and care management. And I will highlight a couple of important outcomes that we measured in that study. So number one is we extended, by this test and treat strategy, we extended gestation for earliest born babies who are born before 32 weeks by 2.5 weeks, which is enormous. And it could make a huge difference in health of the baby. As a matter of fact, using a composite index of health complications of neonates, we reduced severe mortality and morbidity of babies by 18%. So babies are born healthier when they're born later. And as you asked, HeHe, the stay in the hospital was a lot shorter. And for the earliest born babies, those who do end up in the NICU, a very traumatic experience for most, for those who were born before 32 weeks, they stayed in the hospital by almost a month less than babies who were not screened and were not treated for this higher risk for preterm birth. 28 days savings in NICU stays. That's incredible. Truly incredible to be able to go home with your baby a month earlier. We think it's a wonderful outcome.
Yeah, absolutely. Oh my gosh, that bundle sounds life-changing. How many doctors are aware of this bundle? How often are you finding that if we have people who are at higher risk for preterm labor, that their doctors are telling them about this option?
That's a great question. And we are in the midst of our first big campaign to educate the doctors about this new strategy that is available for pregnancy care. And of course, they will learn more and more as months go by. We're also about to publish another important clinical trial that just ended, where we had 5,000 moms in the trial, where we tested similarly to the one I described, which was published in July in the Diagnostics Journal, that tested the trifecta intervention bundle and the preterm test screening for higher risk, and the intervention bundle being applied to those moms. And we're looking forward to sharing the results of that trial with physicians. After that study comes out, a lot more physicians will know. We, of course, will make sure that every OBGYN in the country knows. And our ultimate goal is, frankly, to change the guidelines of every pregnancy to go through screening for preterm birth. And for those who do screen for higher risk, which we set at double the average risk for preterm birth, that's the threshold for when the test shows that you are at higher risk. It's double the risk of average population. So that is written into the guidelines, care guidelines, and every OBGYN screens the expectant moms for preterm birth.
From what I know, we don't have any idea kind of what causes preterm birth. Do we have any answers or theories? There must be some sort of idea out there on why some moms do have this higher risk.
Yes, we do. In talking to the experts in the field, maternal fetal medicine specialists that are opinion leaders and are working with us to develop these innovations, they talk about the biological process of placental function and placental dysfunction, which is an organ. Placenta is an amazing organ that gets developed, the only organ that gets developed in the body for the specific function of supporting the baby through pregnancy. And therefore, the ability of this organ to either meet the demands of the fetus well or not is what our test measures and is the underlying biological process that is at the center of many pathways of what causes preterm birth and the complications. Effectively, preterm test measures placental function or dysfunction in its ability to meet the demands of the growing baby in your belly.
Wow, that's amazing. Okay, you had mentioned being able to do this at your doctor's office with a blood test, but you had also mentioned doing it at home. Are we drawing our own blood at home? How does that work? Tell us a little bit about how do they use it at home?
It's a simple kit. We are very excited to have launched the at-home opportunity to order the test. You just go to sera.com, you click on a button, order preterm test. It comes to you in the mail. It's a small box. I'm happy to show it to you. You prick your finger, and you just need a couple of blood droplets. You are provided in the kit with two Q-tip-like devices, but they look like Q-tips in a lipstick box. So you dip the droplets onto these Q-tips and you close the box and ship it back to our lab in Salt Lake City, Utah. And we send you the report by mail. We, of course, ask you who is your treating physician, or you can ask your physician when you see your physician next. And we will be able to provide the kits to your physicians also, if you prefer. Unfortunately, we do have healthcare deserts, and many mothers don't have obstetric care or regular obstetric care. So we want to make sure that our test is accessible to all. That's why we're excited to have this at-home testing available, and we would be delighted to share the results with your physician, to have our OBGYN nurses talk to you, talk to your physician, and tell you more about what the results of the test mean and what opportunities it provides for you to get care to reduce the risk of preterm birth if you do get tested and your result will show higher risk for preterm birth.
Yeah. What's the cost of the kit?
We are determining the price right now, and we are offering a really generous patient access program. Depending on your income, your ability to pay, we offer generous discounts, and we will offer a discount for everybody who is listening us today.
Nice. Thank you so much. We'll put that code in the show notes for you guys. Zhenya, you have mentioned a couple of things that are outside of the realm of like preterm birth, but I wanted to circle back to it because it's things that my audience are definitely interested in. And these are just questions. I'm a questioner. I love to know. I want to dig deeper, and I always am trying to understand the bigger picture and the bigger impact. So you've mentioned innovation. And I think one thing that you and I can agree on is that we need more innovation. We need more data. We need more science. Maternal health and maternal child health has been really neglected over the years, obviously. And so tell us a little bit about why innovation is important to you and where you see innovation taking maternity care in the future.
Women have been giving birth for tens of thousands as long as humankind existed. And maternal care improved dramatically over the last few thousand years. And unlike some aspects of our healthcare, like oncology, which moved really fast with science, and the physician specialists are really on top of what is the latest and greatest that science has to offer in this high mortality, frankly, scary disease. In Obstetrics is a little bit the other way around. The do no harm and appropriate conservatism prevails because, of course, you want to allow the body to do as good a work as it possibly can and do as little intervention as you possibly can, or not over-medicate, for example, if the pregnancy is going well. However, because in this country, unfortunately, in the last 20 years, in spite of advancements in healthcare, maternal mortality is going up. It sounds honestly outrageous to me that's the case. And it's even sadder that in some populations, it's a much higher risk than in others. So ensuring that innovation can address health equity and the same innovations being available to all moms, regardless of where they live, what their race is, or socioeconomic status. I think it's absolutely critical to ensure that we invest more in research and we make the innovations available to everyone. We need to change the mindsets of researchers, of investors, and entrepreneurs in maternal care space to start bringing more and more innovations to maternal care to reverse this terrible trend of maternal mortality. And unfortunately, babies being born earlier means sometimes lifelong complications. It's not just, do you get out of the hospital sooner with a healthy baby? Sometimes there are heart, lung, and other developmental complications that will need to be taken care of for years after birth of a preterm baby. When we talk to OBGYNs, they are united in wanting more innovation in this space, more tools to screen pregnancies for higher risk, and more interventions to be able to prevent it. Because of course, every physician wants to do best for her or his customers. And I want to encourage every expectant mother to seek out information about innovations that are available, only because there is this lag time between when the innovation becomes available in the market and when everybody knows about it and everybody uses it. Sometimes it could be a decade before every single OBGYN starts using it in his or her practice. But an expectant mom with her baby and thinking about on a daily basis, like I was, what can I do to make sure that my baby gets born healthy, can find the information, can access the best care available today. That's what's the most important. And I'm super grateful that you're running your podcast, HeHe, and make the innovations available to all. That's incredible. And I think will make a big difference. And
Yeah,
over
absolutely.
time, over time, the physicians will get more and more information and get more and more comfortable with new tools and include them in their practice.
Yeah, absolutely. One of the goals with this podcast is to increase access, and that means bringing the newest things that may not necessarily be mainstream yet to my largest platform. I reach the most ears here, and so I want to spread the messages that just this is an option, not that it is necessarily. I hear that your stance is that it is for everyone, but there are obviously people who don't believe that more interventions are necessarily good. What do you say to people who say the more you test for, the more you're going to find? And are there any risks that people need to know about, or is it a pretty riskless test?
I am so glad you asked that question because, of course, some of us may think, you know what, I don't know about it and I am at peace and I hope for the best. The risk is there whether you know it or not. But if you do face preterm birth and sometimes devastating consequences for the health of the baby, knowing that you could have done something about it would bother me personally. And this is a completely safe, it's a finger prick test. It's done quickly, super safely. And the interventions that the physicians will do, the baby aspirin, the vaginal progesterone, and the conversation with the nurse on a weekly basis are also incredibly safe. So what's the cost? The cost is knowledge and doing something to be able to prevent very, very negative consequences that will affect 1 out of 10 pregnancies. It's not one of those really rare occasions when preterm birth happens. 1 out of 10 is not that rare. If 10 people who were pregnant, realizing that 1 out of 10 of them likely have had preterm birth, should wake us up to say, you should find out your personal pregnancy risk for this pregnancy, because risk changes from one pregnancy to another, especially if it's your first time and there are no other risk factors, no other information to go off of. That's why preterm test is really for asymptomatic, otherwise healthy pregnancies, because spontaneous preterm birth has been unpredictable before, but now can be predicted. And importantly, and not completely, if not completely prevented, but certainly ameliorated significantly.
Yeah, to get more people to that term point.
That's exactly right. And if you talk to physicians, they will tell you how important every single day of gestation means for the health of the baby, every day, every week, and how important it is to get to full term, if they haven't talked to you already. But that is the goal, to get to full term and get to a healthy baby at the end of the pregnancy.
Yeah. And you don't need a prescription or a physician's note or a doctor's note or any sort of confirmation from your doctor in order to order the test online, or do you?
We take care of that online in our ordering process. If you have a physician, we will get the physician's permission, or one of our physicians on staff can help with that. It
Absolutely.
really
So
depends on the
cool.
state you live in.
Okay, got it. Okay, and what if someone orders a test, they didn't necessarily need to tell their doctor about it, and they got the results, they're at a higher risk. Now they want to implement this with their doctor, and their doctor is not aware of this protocol. How can they have this conversation? What can they ask? Where can they direct their doctor?
We will provide tools to talk about the test with your doctor, something you can hit print on and bring to your next appointment. We also ask for the information about your physician. We will reach out on your behalf and educate the physician about the test and the power of the test. We've got physicians on staff that do that all day long, educate the physicians about the test and this incredible innovation. We also have nurses on staff that can provide care management and this weekly conversation. So we will get the resources to you if you test higher for preterm birth and direct you to where you can get care.
So let me get this straight. If someone tests high risk on your test, they can call your office and have a nurse's conversation every week, like the protocol says, even if their provider doesn't offer it.
We have the infrastructure to do that. We will likely find someone in your area who can provide those care management services. Because of course, we want the nurse to be able to guide you if you need access, for example, to hospital-grade obstetric care. We want to be able to guide you to the right place to support your birth. We do have nurses on staff. We will either have our nurses call you, or we will direct you to a physician office nearby who offers those services.
That is amazing, because what came to mind are the healthcare deserts that you had spoken about, but then also staffing issues, which you and I both know is a huge issue. I just imagine a lot of hospitals and clinics saying, we don't have the staff. We can't dedicate an entire nurse to this job, this role, because staffing is already so tight. So that is fantastic. Wow.
Yes.
This is so cool. Okay, is there anything else that people need to know about the test?
It's available now. It's very easy to find on Sera.com. Go check it out. There's a lot of information on preterm birth, on risks, on opportunities to reduce your risk for preterm birth. Find us. There's also 2 other quick things I wanted to mention. One is preterm test is able to predict higher risk for preterm birth between weeks 18 and 21 of pregnancy. It's actually really important to learn about the test before, so you can get the kit in time to draw the blood in that window in order to quickly get the results. We'll send the results within 3 to 5 days and start interventions if you do get the result that you are at higher risk for preterm birth, because it's important to start the interventions as soon as you get tested. So that's that preterm test window that it's important to keep in mind. Second is the price of the test will range depending on where you are, your ability to pay. We will do our best to make the test accessible to all. And of course, as I mentioned, giving the discount to everybody who is hearing this podcast.
Thank you so much for that. So if someone is past the 18 to 21 week window, is it still worth testing and they would still test higher risk, or unfortunately we've missed the window? It reminds me of fertility testing. Once it's gone, you have to wait until next month.
Unfortunately, after 21st week of gestation, we will not be able to test. So that's why I mentioned it's very important to learn about the test and plan to take the test between weeks 18 and 21 of pregnancy.
And why does that happen? This is just my curiosity, is like, why that window? What's so special? What happens?
I am so glad you asked. Sera Prognostics mapped over 300 proteins that get expressed during the pregnancy. And we understand the levels, the ratios between proteins, and have a lot of products in our pipeline that can predict many things that happen in the pregnancy. In preterm test, we picked 2 proteins and we measure the ratio between those 2 that can reliably predict a risk of preterm birth. And in specific weeks between week 18 and 21 of pregnancy, those 2 proteins can be reliably expressed, gathered, and have that predictive power. So that's why the window of testing is so important. During other weeks of pregnancy, maybe other proteins become more predictive, but not those 2 that we use to predict preterm birth. I hope that answers your question.
Yes, it does. Absolutely. This has been really cool. Preterm birth obviously is a big problem that we're facing, especially if our bad stats are on the rise. It's very clear that innovation is needed. Some interventions are needed, and when we have all the puzzle pieces, we can intervene appropriately without over intervening, like you mentioned. And I think for so many of us, that is the goal, and it can feel so overwhelming in the healthcare system that we have. So I just wanted to say that I think this product is really cool. I'm excited to see the changes that it can make in maternity care and maternal health and our outcomes. And thanks for being on the show. This was a really cool conversation.
Thank you so much. As a mom of 3, I wish this was available when I was pregnant 10 years ago. I just got this thick book, What to Expect When You're Expecting, opened it once, got scared, closed it, and never read it again. Instead, I would have loved to have seen personalized information about each pregnancy, if it is at high risk for preterm birth or not. Should I worry? Should I not? And what can I do to make it better? Thank you for doing the work you're doing, HeHe, and for helping all of us expectant moms someday out there to have healthy babies.
Absolutely. Remind us one more time where people can get the test online. And if there are any medical professionals listening that want to incorporate this in their practice or want to introduce this to their hospital system, where can they connect with you as well?
Please go to sera.com. If you are an expectant mom, click on Get the Test. If you are a physician, please click on For Physicians. We would love to get in touch with you and tell you more about preterm test.
Amazing. And are you guys on social media at all?
We are. You can find us on all of the major platforms. Find us, reach out, and we look forward to staying in touch with all of you.
Okay, perfect. All right, you guys. I'll see you guys in the next episode. Be sure to follow Sera Prognostics on the social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye!